The Arizona Veterans Service Advisory Commission sponsored a Veterans Town Hall meeting in the Lee Little Theater at Eastern Arizona College on Saturday, January 16th. After posting the colors and reciting the Pledge of Allegiance, guest speaker United States Representative Ann Kirkpatrick was introduced.
Thank all the people who put this together. Valerie Williams is here somewhere. I understand that she worked very, very long and hard on this. I'm really honored to be here today. I come from a long family of veterans. My mother's uncle served in World War I and came to Arizona to the Veterans Hospital in Prescott to recover from his injuries. And he loved Arizona so much that he bought a ranch over near Snowflake and stayed. So that's where my mother's family roots started. Last year, when they were talking about charging veterans personal insurance for their health care, I thought that was wrong. And so I led a group of congressmen and women. We put together a letter to the president. We said, don't do that. And they backed down. So we were able to prevent that from happening. Then we realized that so many of our veterans who are on disability aren't getting adjustments periodically to help them with rising costs. And so we introduced legislation. It was my first bill to be passed out of the House and signed into law so that we can have those automatic increases in disability benefits. Then we looked at the overall veterans budgets. I visited the VA hospital and administration said, it's really hard for us to plan ahead to provide what we want for our veterans because we don't know what our budget's going to be from year to year. So we were able in Congress this past year to approve the budget 1 year in advance so that our hospitals, our service providers can know what they're working with and have a seamless transition and delivery of those benefits to you. But there's still a lot to be done. I know from you, a lot of you, you're really, really concerned about your health care. And we've got to do something that's smart and makes sense with that. I was given a question before I came up here specifically about TRICARE. How will the new health care plan affect TRICARE? It doesn't affect TRICARE. The House version of the bill, which I am most familiar with because I'm in the House, protects veterans. We made sure that there was nothing in that bill that would take away in any way what is in the Veterans Administration for your health care benefits. And I'll continue to fight for that. So I want to give you that reassurance today.
Some veterans commented on their frustrations with the local clinic.
Anything in the works where we can get at least one more doctor here in some of the rural areas where we don't have to wait a month and a half or 2 months just to see a doctor here in Stafford like we are right now. And to furthermore with that is to get a doctor here, or is there something set up where we can get a doctor in here or doctors here in the rural areas that actually want to be here? Because every time I've gone to the doctor here in Stafford, I get the feeling that she really doesn't want to be here, and she really doesn't care about the veterans because it seems that she's upset about being in a rural area.
And I'm in charge of all the CBOCs for Yuma, Stafford, Casa Grande, Cerro Vista. What I want to let you know about our CBOC here is we have about 900 patients enrolled. The CBOC has been here for a good while. I've been with the VA for about 1.5 years now. I'm retired Air Force, retired just in 2008. And my understanding of this clinic down here is you've gone for a very long period of time without continuity of care of having a provider here for a long time. We've had real struggles in trying, honestly, to recruit to rural areas. We were able to recruit this physician who came to us about October last year, coming to us because she wanted, one, to work in a rural community, and two, she wanted to serve the underserved, which she felt were the veterans.
We have 3 VA medical centers, and we have 28 community-based outpatient clinics. And I heard the gentleman talk about the clinic here. I've been to the clinic here, and I agree with that. I think the reception needs to be a little bit better at that clinic. I visited the clinic here. I think we can make that happen.
Click Part 2 for more coverage and interviews of the Town Hall.